Tanja, hi, and thank you so much for joining me here on Faces of Digital Health to discuss the impact of robots on mental health, on healthcare, what role they can play. You're a medical anthropologist that also likes to look at the impact of technology on people, on care delivery, on different aspects that we don't really often talk about on this podcast. That's why I'm really, really excited that you're here with me. It's a little bit funny to speak to you in English because we're both Slovenian, although you are a researcher in the Netherlands. So welcome.
Thank you so much. Thank you for having me.
As I mentioned, you're a medical anthropologist focused on covering the impact of technology on medicine and health, and currently you're researching robotics. Do you already have a robot? Why did you choose this topic?
That's a great question. I actually don't have a robot, although my family did encourage me to get one. And I was really surprised because then I went to look into how could I get one, and it turned out they were actually quite inexpensive. So you can get a basic robot cat or dog for as little as, I think, 140 euros. Which is really not that much. I mean, this is a very basic model. There are more expensive ones. So I am thinking of getting one for research
Okay.
purposes, obviously.
Yeah. I'm actually surprised by those numbers because the numbers that I saw were more in the range of 6,000 euros. And when it comes to humanoid robots, which are coming to the market in 2026, the price range there is expected to be around 20,000 euros. So, why are you interested in robots in the first place? What fascinated you, and how do you see the differences between animal robots, toy robots for kids, and humanoid robots that are now promoted as the thing that's going to significantly help us with chores at home and similar tasks?
Yeah. Well, I'm interested in new emerging technologies in a more general way. So I've been doing research on digital technologies like everyday mobile phones, smartphones, and so on for elder care at a distance for a decade. And I wrote a book about that. It's called Calling Family. And after that, I thought, wow, I was really surprised by some of the news items that I saw about robots for elder care. And I thought, well, that could be the next thing. That is something that has been in the making, actually now for the past 10, 15, sometimes even 20 years. And I'm very curious about how these new technologies that are being developed could support elder care, and also how are people accepting them or not, right? So the question here is of integration. Are these robots easy to integrate, or what are the challenges of the integration? But also, how do people accept or reject these new technologies, right? So I'm very interested in this, in the relationship of people to robots, and how these technologies actually also influence us. So it's not that the technologies are just the tools that we use to achieve certain means, for example, the means of communication or care, but the question is really, how do these technologies impact us? How do they shape how we relate to these objects, but also to other people through these objects? And in the end, also, what does interacting with these technologies mean for our own self, for who we are, for who we are as humans, and also who we are as good children, as good parents, as family members and workers, and so on. So this is really what excites me about new technologies. So I always place people at the center, but then look at how the technologies shape us as people.
Okay. So, what have you found out so far in terms of the impact of robots on mental health and the role that they can play in healthcare? In her book, The New Breed, Kate Darling does an extensive overview on how 80% of vacuum cleaners, Roombas, the round-shaped vacuum cleaners. So 80% of those robots have names. She discusses how people get attached to robots, and how, as long as they're not too human-like, which is creepy, we somehow like them. So what did you find out so far? Simply put, is it more on, or is the impact more on the good side? Is it more on the bad side?
Well, the impact is always complex, right? If you ask any anthropologist, they will tell you it's complex, whatever you're asking them about. So the robots are very interesting, whatever shape they take, right? Either if they look as humans or if they look as animals or anything in between, because they can be of very many different forms. But they're so interesting because we don't exactly know what they are. So there are so many definitions. And yeah, the author that you just mentioned, right? She also writes, well, if you ask a robot, you don't ask a robot or roboticist what a robot is, because they will actually, each of them will give you a different explanation. And this is what makes robots such a fertile ground to play with these technologies, right? So you can say that we are exploring what they are, and at the same time, they become what we think they are in a relationship with us. So it always depends. What a robot is depends on the situation in which this device is. Is it used in a hospital? Is it used at home? Who are the people around the robot? How do they think of the robot? And so on. So we found that robots actually have a very ambiguous identity, or a very fluid identity. And that also often makes people react to them in a very ironic way. They could say, oh, this is so. For example, I was looking at some fieldwork data that a colleague of mine, Anna Mann, collected in an Austrian hospital. She was doing field work at a dialysis unit, and there she came across this robot called Paro, which looks like a seal. So that is one of the robots that costs around 6,000 euros. And it was just there. It was used by actually just one of the patients, an older lady. But the staff and the patients there reacted to this robot in very different ways. So some would make fun of it. Some would say, oh, this is so cute, and they would talk to the robot. They would give the name to the robot. They would talk to the robot using pronouns like she. They would say, oh, it's so cute, like a baby or like a baby animal. So this is often an attitude, right? And it also changed. So some of the nurses said, okay, we can go along with this. And other nurses said, oh, no, this is like not, like I cannot accept this. This is not like ethically, morally, this is not, I cannot go along with this story, right? So they would introduce the robot to the patient because they were asked by a senior person to do so. But the way they would do it was through joking, right? So there was no like direct resistance against this initiative, but there was resistance in the way it was introduced to the patients. So, the patients would also jokingly reply and wouldn't really take it in. So there are different kinds of resistances as well, right? And there was just a lot of ambivalence. They could see that for some people, it really worked well. And they loved the robot. This older lady who was interacting with the robot a lot, she really loved it. She said, I'm in love with those eyes. And
Mm-hmm.
it was her way to pass the time at a dialysis unit. You have to imagine, like when you have to be there at the dialysis several times a week for many hours. So it's almost like a part-time job, right? So you have to have something to spend time. And for this lady, it worked. But then
So
eventually, Mhm.
what did the robot actually do? Like, so what was the interaction like?
Yeah.
Uh,
So
how were the relationships formed? And also, is there any research that would say what impacts how a particular person is going to respond to a robot?
Mhm. So that is the research that I'm doing now. So I got a funding from the Dutch government, and this is exactly what I'm looking into, to find out how we could do more personalized care with social robots. Is there any way to find out what works for whom? So which people accept the robot and benefit from it, and which not, and need maybe some other technological or non-technological support. The interaction with the robot was very basic in the sense that it was not linguistic communication, right? So Paro doesn't talk. And other robots that look like animals that I know of also don't talk. There's a robot that is shaped as a plant, developed here in the Netherlands. Now that one talks. And that can also be it can be interesting, but it can also be disturbing, especially with people with dementia who are not quite sure why a plant is talking to them all of a sudden, right?
Mm-hmm.
That can be very confusing. So, but the animal robots don't talk. They really animate. They really, what's the word?
Copy the
Yeah,
behavior of
copy.
actual animals.
Yeah, exactly. They copy actual animals, because Paro is an unfamiliar animal for many. It's also new, so they don't have many expectations. Like with a cat or a dog, people already expect, oh, a dog should bark and should jump and should do this and that. But with the seal, it's different. Many people don't have any expectations of a seal because they're not used to having this interaction with a live seal, right? So this sort of robots make some noises, some sounds. The Paro actually responds to 5 languages, including Dutch. It responds to its name. It's also, every Paro apparently is handmade. So the face is a little bit, it's supposed to be an individual being as well, or an individual device. Um, and it is also warm, it is also soft, and so on. So there are many um, sensors integrated into that, and it tries to be petted. So the goal is a positive interaction, and it avoids to be hit. So if somebody starts to become agitated and so on, then it becomes calmer and so on. At least that's as much as I know about the Paro. So, yeah, I'm very curious if any of the new technologies like AI are also going to be integrated into these robots. So far, I haven't seen it, but
Mm-hmm.
I'm curious about that.
Okay. Um, Robots actually have a long history of existence. There's like the most known example that many of us will remember are Tamagotchis, the little small devices where you basically had a small electronic pet that you had to feed, you had to nurture. There's Sony Aibo, the dog. I think it was a dog. That was used years ago and then I think discontinued. So what are you observing in terms of why, in a way, are robots as companions not more widespread? And to which extent is research still ongoing in terms of how do we use them? When we met in Ljubljana, we discussed the use of robots in elderly care homes. So maybe you can talk a little bit more about that. I'm just trying to understand the dynamics and the changes that are happening over years with societal changes as well.
That's a great question. Yeah. So Paro has actually been in the making for the past 30 years, which is a long time, right? I was recently asked, oh, these robots are nowhere to be seen. It's such a new emerging technology, right? Do you even have a research topic? And I said, well, yeah, the Paros have been around for 3 decades. It's a long time. So, it also means that it has been developed quite well, and what's interesting is that, for example, AI has not been integrated into the Paro, right? Video cameras have not been integrated, and that was with a purpose. And the purpose, so the reason is related to privacy questions. People don't want to be recorded or have a feeling that their data is being collected inadvertently and so on. I think that this is coming up as a feeling for people, right?
Mm-hmm.
As a concern, often. Um, what is interesting is that governments around the world in the past 20 years or so have really been investing a lot into the development of robots. And I'm fascinated by the my finding, actually, that the story is so similar around the world. And the story is that the world population is aging. So in most countries around the world, the number of people getting older, so above 65 years of age, is increasing significantly. And the projections are it's just going to continue. And then the problem becomes care. How do we care for these people, right? Because there are not, so the number of healthcare workers and long-term workers, long-term care workers is decreasing. So healthcare and care for older people is a big problem. So how to solve that? And often the solution is technological. So we need to come up with new technologies. And actually, some researchers have started a whole new field, which is geron technologies. So it's about technologies that are specifically developed for the purposes of older people. And social robots are part of that story. So a lot of funding has been going into that direction, but not many robots are seen, right? I mean, when I ask people, when I ask students, for example, about robots, they're like, like, what do you mean? Maybe in a restaurant, like somebody remembers a robot that they saw in a restaurant that was like collecting plates, empty plates and so on. So despite this huge funding incentives, and also many robots being developed, especially in Japan. Like as
Mm-hmm.
soon as I start talking about robots, everybody sends me to Japan. Oh, robots, you have to go to Japan. But even there are not that many.
Mm-hmm.
So that is the question also for me. It's like, how come that there are not that many? I have actually come across many robots that have been recently discontinued.
Mm-hmm.
Lots of companies that have been producing robots have stopped because there was no market.
Mm-hmm.
And even Japan had this idea that they will not only replace their own care workers with robots, but also that they will produce robots for export because the whole world will need them, right?
Yeah.
Well, many of these initiatives didn't go through, and that's a very curious question. Why did that happen? And of course, one of the reasons is that they're not so easily integrated into the everyday life, and that care is much more complex than many have thought.
Mm-hmm.
Um, so I think that this integration is a very complex process, and robots also demand a lot of care for themselves. So it's often not that they replace a person, but that people who are already doing care work also need to start taking care of the robots and other
Mm-hmm.
technologies that are introduced in care homes.
That's a common issue that's coming up when we talk about the move to care at home, virtual care, telemedicine, remote clinical trials. When you give people technologies, suddenly you basically need technical workers that are going to also answer any questions patients might have if a device doesn't work or if they don't know how the device works. So I imagine, yeah, that with the robots, the same thing applies. Like you need a technician that does something if something goes wrong.
Yeah, exactly. So often there was the expectation, for example, that hospitals or care workers, nurses who monitor, for example, who do telemonitoring, would not have to travel to people's homes anymore, and that's why you would need less of them, right? Less people. But that was not the case at all. So research found that what changes is the routines. So the nurses still have to be there, but they have to learn new tasks. They have to take care of alarms that go off. They have to learn how to maintain the system, and how to communicate also through these technologies. So these are all basically the work changes, but
Hmm.
there's not. It doesn't mean that there is less work.
Yeah. Let's go back to Japan a little bit. As you mentioned, it's the country that's most often mentioned as the country where robots are well accepted because of the cartoons in Japan and the culture that supposedly describes and portrays robots as friends of humans, unlike the fearful negative Terminator image that we have in the West. So, what have you discovered during your research so far in terms of what are some of the potential misconceptions around robots in Japan? Why do we always think about it when we talk about this topic, and what can we maybe learn from Japan based on their experiences?
Mhm. Well, I haven't done research in Japan myself, but I've learned from other researchers who have done that. One of them is James Wright, who has written a wonderful book called Robots Won't Save Japan. Um, and what is really interesting to me is that, yeah, there is this idea of robot as a highly technological society. I recently talked to a student from Japan who said, "Oh, I'm actually surprised that like people always think that my country is so, technological and like everything is super high tech and so on." But I didn't have that experience at all, he said. What I've learned from reading ethnographic research, it's that this is also a strategically constructed image of the country. So Japan itself has been working a lot on coming up with an image of itself, of its identity as a country that is highly technologically developed and that can also develop technology for the rest of the world. And I think this is significant because it's a part of the economic plan, right? Um, One of the plans that Japan had with robots was actually also related to care workers as immigrants, right? So Japan has a lot of older people. It's one of the oldest societies in the world. And then the question again was, how are we going to take care of them, right? And of course, one possibility, which is also common in other countries around the world, is to import care workers. And in the case of Japan, that would be from other Asian countries. But there was a very clear unease with this idea. So the question was, do we bring immigrants or do we create robots? Right. So it's sort of presented as an opposition. And at the beginning, they tried with the robots. That didn't quite work out so far. So even Japan has started to open up more to having migrant carers, indeed.
Mm, very, very interesting. And if we move from Japan to other countries, you mentioned research that was done in a hospital in Austria. Did any other research look at the potential of robots for mental health or for the companionship in elderly care facilities? And what do we know based on that?
Mhm. Well, I think the most research has been done with Paro because the designer of Paro has been very eager to prove that this is useful technology. And in the US, it's even been classified as a medical device, the SILA. So also there is a lot of very convincing research that interacting with Paro really helps when it comes to depression, post-traumatic stress disorder, um, anxiety, and so on. So, according to that research, the number of drugs, prescription drugs that people need, can lower by 30% or something like that, which is a huge number, right? And that is also one of the reasons why some of these robots were accepted into the care homes in the Netherlands and in countries like Denmark. So in Denmark, they were so enthusiastic about this research that they introduced robots to many care homes in the country. They said, okay, we're just going to do that. So they bought them, they put them there. But then one of my colleagues, who is an ethnographer, went to check where are these robots and how are they doing and so on. And she discovered that they were nowhere. Right? She really didn't find them. And in the end, she discovered that they were put into cupboards and in the toilets and they were put away. And she was really surprised by that. She said, what's going on? And it turned out that the carers there were really worried about the robots. They said, "Oh, this is such an expensive technology, and we don't want it to be destroyed
Break.
or anything like
Yeah.
that." So this is one of the reasons why they said, "Well, we need to take care of it." But of course, that there are many more. And this is what I'm currently researching. It's like what is happening. Like just yesterday, I was talking to people from a care home here near Amsterdam, and they told me, yeah, it really depends on the workers, on the carers. So some of them are enthusiastic and they would engage with them, but then maybe they would change. Maybe the care staff would change. New people would come in and they wouldn't even know that this robot was there. So they wouldn't interact with it. They wouldn't introduce it. So this is the kind of management or work organization with robots that I'm curious about. So I want to see how these robots can be integrated into work organization and how do they reshape it. So, but I think what is significant is, are these technologies introduced top down, like in Denmark, right? They're like a government decision is made and then, or at some level, managerial level, the decision is made and they're just put down onto robots, onto people. Or if people are actually curious about them and they start buying them themselves. So in the Netherlands, this is a much more bottom-up approach now. They told me that even sometimes they receive these robots as gifts from family members. Maybe if an older person dies, then the family members want to give a gift to the care institution as a thank you. And this is one of the options, for example. So it's a very bottom-up approach, and there are, which I find very interesting, more and more of these robots in the Netherlands. That's what I'm told by the people who work in these homes. Yeah. So
Mm. Do you have any hypotheses around what you will find? I guess I'm wondering if the timing is just not there yet for the robots to be used more widely. As you mentioned yourself, the culture and the environment are also very important. If we just look at, for example, California or San Francisco, probably also I would assume some of the Chinese environments. You see self-driving cars, they're normal there. Robots, delivery robots are also common already. And if you just come from an environment where you don't see that as much, that's a bit shocking. But for people that are already used to that, it's just the new normal. So with technology, the question is always, is the timing also right? So, like Google Glasses failed completely. Now Facebook is again kind of reinventing that whole idea with Facebook Glasses, and we'll see to which extent if that idea is going to work differently because the timing is different.
yeah, for sure. I mean, what is changing is how we are sensitized to new technologies, right? So I often ask my students, do you remember the first time you used the internet? I do. And some of my students do, but many of them don't because they were born into this world where the internet exists, right? Somebody actually told me, well, my father installed the internet into our house the same day I was born. So they had two babies at the same time, I guess. Um, But I think that being born into the world of this technology, it makes you sensitized to it in a very different way. And that also makes me think about the robots that are being developed today. I sometimes wonder because they are being developed and tested with people who are old today, who grew up in a very different world, but they are actually being built for people of the future, people who are going to be older in the future. And they might react to robots very differently, and nobody knows how.
Yeah.
So, as an anthropologist, I don't work that much with hypotheses, actually, not at all. I mean, of
Hmm.
course, I'm also sensitized to some ideas and so on. I'm not like a blank slate, but I try not to have hypotheses, but just go out there into the field and see how the field surprises me. Right?
Absolutely. Makes absolute sense. And you reminded me of a very important topic when you said, that we're building robots for future generations on and testing that on older generations that have completely different expectations of what the world looks like. And I think it reminds me of all the concerns we have around social media and the youngest populations, children, and completely forgetting what is the impact on older generations that also do not have potentially those filters or the understanding of technology and the impact that it may have for them.
Yeah. I mean, with digital technologies and social media and so on, I find it fascinating that so many initiatives are focusing on children, which is right. I mean, children are vulnerable and they are the future and so on. Also on older people, but only in relation to literacy.
Hmm. Yeah.
So access, do they have access? Do they understand how to use digital technologies and so on? Very, very little focusing on adults, people who are parents right now. And I think I think this is really key and should be more on the radar of researchers and policymakers and so on. Because after all, I mean, it is the parents who have to make decisions about technologies as well for their children and so on. So yeah, I find that curious, and I think that there's much more to be said in relation to the like people who are adults right now. Yeah.
Hmm. Yeah, absolutely. I always say that the current generation of kids are misfortunate because the parents that they have, because the research wasn't there yet, we didn't realize like what are the potential negative impacts of technology on human development. And because of the experiences that we've gained through the pandemic and the research that's coming up lately on the impact of mental of social media, etc., on mental health of young children, it's also, I think, that contributes to higher degrees of carefulness when it comes to AI. So we'll see how that's going to change over time, because it's visible that AI can be even more dangerous, meaning chatbots and just large language models that are easily available to everyone.
Yeah. Yeah, my stance is one of technological realist. That's how I like to describe myself, right? So I think I just yesterday somebody asked me, so, oh, this is like terrible, technology is terrible. And I said, well, without technology, without this, I'm pretty useless. So I think that we need to recognize the positive sides of technology where the positive sides are due, right? But because it's such an emerging field, there's also a lot of experimentation and sometimes with even tragic consequences. Um, so I think realism, like balancing, finding out, okay, what is really needed, what is really making the lives of the most people better, right? That is very important. And a student also asked me recently, said, well, is it going to happen that it's going to be more valuable to have a human who can give you human attention and human care and human support, that is going to be more valuable in the future than having a robot that is involved in supporting care, right? And I think that's a great question. That's a great question. So I think we, like, collectively, as humans, really need to think about what are our values? What is important? What do we want to invest in? And what is it that we want to delegate to technology? So is it important to keep our memory? Is it important
Mm.
to develop our thinking? Is it important to remain creative? So often when we have these conversations about AI replacing creative workers and so on, I think it's important to focus on creativity as a process rather than a product that can be marketed and sold, right?
Mm-hmm.
So that part of ourselves we need to keep and keep investing into being creative and say, okay, I can write a poem and I can draw something and I can write something, and I do it because this is the way of becoming. It's through creation that we become who we are. It is through writing that we learn how to think.
Mm-hmm.
So are we really ready to delegate that to technology? And if we do that, what do we become?
Yeah.
Yeah.
It's a very important question. I think a friend of mine was just telling me how some research already shows that when you delegate, the thinking part to technology, how basically your brain becomes more lazy. So yeah, a lot of research is happening in that space. There's already clinics in Japan to treat the so-called I think it's digital dementia, basically the impact of getting too much information through technology on your brain. So the negative impact, some call it brain rot, is also another expression that is used. So for sure, a critical question when we think about how do we want to use technology. And also, I think the book that I mentioned before also mentions how we too often try to think of humanoid robots as replacing humans, but that potentially shouldn't be the goal. If I think of, like, from my perspective, I would love to have a robot that would do chores around the house, but I don't necessarily want that robot to do too much. Like, I'm good if it's just like super good at doing the dishes, doing the laundry, and that's good enough. The danger with AI is how do you limit the reinforcement learning and the learning system if AI is embedded, I guess, in these tools, in essence. Yeah, I
In
don't
the
know.
end, the danger is if you read Karel Čapek's book, right? So that's the novel that introduced the words robot. There, a company creates mechanical people basically to work in the industry, right? To replace the human labor. And that's why this whole narrative of robots replacing people is so strong, powerful, and also scary for many. But we can also think about, well, the work is still going to be there. It's just going to be different work. So the nature of work is changing. But also, are there ways in which we are becoming more robotic by delegating these parts of ourselves, like creativity, like memory, presence, attention, connection? Because even in this novel, the robots didn't look like some mechanical, tin boxes that move around, but they actually look very, very, very human-like.
Hmm.
They were just less demanding in terms of how much rest they need and so on. So I think it's really interesting to explore, like, what is it actually? So that's also one of my main interests in robots. It's like they're this liminal category. They're neither here nor there. They remind us of people that much, but they're not really, because they're not alive. We project a lot onto them. this phenomena of anthropomorphization is very, very common, right? So it's not that robots are either intelligent or feeling or thinking and things like that. They make some operations, yes. They have some, like, they work on operations, but we often project our feelings and so on onto them, right? Even
Mm-hmm.
empathy. They're not empathic, but we feel empathized with when we
Mm-hmm.
talk to chatbots and so on. And that can be very important, right? Um,
Yeah,
yeah.
you just reminded me actually again on one of the findings from research of robots that's very, very relevant also for the understanding of ChatGPT and other chatbots. And that is that somehow when people create that connection with robots, they also feel like they can trust them more. One research showed that if a robot tried to hug people, then they felt more compelled to maybe disclose information that they would not disclose to another person. And similarly, chatbots today are built in a way to create a space or the impression of safety and a trust that then prompts people to really open up in ways that they would potentially have a hard time to open up to other people. So yeah, I don't know if you have a comment, if you saw anything in that sense from research that could be applied to how we interact with AI today as well.
Yeah. I mean, these are fascinating questions, right? Um, I think it's very interesting what are we becoming as humanity through these interactions with technology, and how actually it is sometimes safer. It is safer sometimes to talk to chatbots than to people. And that makes me think about, well, what is happening to people then? And I would say that really, really being very, very conscious and aware of what we are doing with technologies and what the technologies are doing back to us is highly, highly important. So the whole work that I did for about care at a distance, um, which I write about in my book, Calling Family, is really going into the very subtle impacts of technology on who we are as good children, as good daughters, as good sons, and so on. And these are very, very subtle changes, but they're big shifts within family structure. So I think it's very important to pay attention to that, and we can only do that if we from one time to another. So every once in a while, take a step back and really deconnect from these technologies and just spend some time with ourselves and with other
Mm-hmm.
people and say, okay, this is who we are. And so, and what do we want from life? What kind of life we want? I mean, these are very philosophical questions, but we need to ask them now. They can
Mm-hmm.
be very difficult questions, but we need to ask them now because
Do
that
you
will.
think
Mhm.
do you think we are asking them enough? Because the world is changing really fast. I think the impact of AI in the last 2, 3 years has been exponential. And the question is, do we even have time to really, like, are we capable of thinking fast enough, of reflecting fast enough, or is technology faster?
I'm you know, it's of course it's very difficult to talk about the people and the we, right? I mean, because there are so many people and they're only specific people for me as an anthropologist. But I'm also very happy to see quite a lot of reflection among students that I encounter, and also online among my colleagues who talk about, for example, slow academia and slow work. And it's like, no, we need to slow down. We need to calm ourselves down and calm our mind, because that is the only way that we can actually find a way through this uncertainty that we are living with, including the technologies that we're using, because nobody really knows where are they taking us. You know, you can have the utopian stories, you can have the dystopian stories. The truth is probably somewhere in the middle, right? But the thing is, I find it very important that we realize that these are the collective choices that we are making as individuals, right? We individually decide which technologies we engage with, how much, for what purposes, what do we delegate. These are all individual choices that we need to think about because they become collective eventually.
Hmm.
And the question is not, do we have time? We have to make time. It's just an imperative.
Yeah, yeah. I agree. One question that did arise to me there, when you talked about individual choices and that we need to decide how we're going to use technology is to which extent are you following the current developments in Australia with the social media ban? That was a very uh, parental decision. So, like kids don't know what's good for them. And yeah, we need to protect them. And now, if you look at the responses of some of the children, their response is that the ban is not the answer, that more education is. But at the same time, there's a really, really good video that kind of really nicely illustrates all the dangers on social media and online, where there's a child sitting in the room, and then the parent comes in and says, just be careful when you use these technologies. And then there's like 10 other people in the room, and one represents a predator, one represents violence, one represents something else, with the point being that sometimes just saying it's on you to make the right choices is really not the right approach, because we all know that in the environment shapes our behavior. So we also need to shape our environment in order to protect the most vulnerable people. So what are your observations in that sense? Any thoughts?
Right? It's always, I might need to emphasize the individual choice, but I also realize that this is within the society, right? And sometimes I say, wow, we've created a world in which it's really impossible to be a functioning citizen without having an email, without having a smartphone. In the Netherlands, for example, there's almost no use of cash because we only have digital finances. Um, So we have created collectively, we have created societies in which it's become very, very difficult, next to impossible, to not use smartphones. So yeah, I guess some people's individual choices here matter more than others, right? Because they're still in the end decision makers. But it doesn't mean that it's all in their hands. Um, Now, with the ban in Australia, of course, as an anthropologist, I will say, well, it's definitely more complex than that, right? Because they also um, only banned several platforms, the major platforms. And that makes it clear that there are many other platforms that will come up and that people will find. And also for children, I mean, some of the researchers I know are very much against bans. As you said, they are more about education, right? Yes, I can definitely see that. So it's a very tricky, difficult situation, but one that we shouldn't shy away from, right? Discussions here are very, very important. But then I'm also thinking about the exhausted parents that have two jobs and are tired and need to bring the food on the table and what to do, right? And then also think of that, which is a lot.
I guess we'll see what happens, right? Because this is a really big experiment in a way that many parents are encouraged by and hope to see adopted in other countries as well. But we don't really know how everything's going to play out. What we do know, though, is that it's in human nature to find holes in the systems, holes in the rules. So it's gonna be quite a journey to see how this is gonna play out.
Yeah. It is also true that it's not only so on the one hand you have the infrastructures, digital infrastructures that we have created. You have the companies that are creating their products for marketing, right? I mean for business. You have the social pressure of people and how much these technologies have become integrated into our social relations. But then you also have a very biological side of it, right? Which is sometimes the use of digital technologies is very similar to physiologically to the process of addiction. And we had a very interesting academic panel recently on digital addiction, where, of course, the book by Jonathan Haidt was
Mm-hmm.
discussed.
Yeah.
Yeah. And indeed, it was, well, the researchers said, well, it's not so straightforward at all, because what if you have a child who is really suffering from a chronic illness and then having a contact with friends through the social media is really essential for them, right?
Mm-hmm.
So that's also a part of the story. But what I found interesting was that this addiction was sometimes compared to addiction to alcohol, or addiction to drugs. But I think it might be more fruitful to think about the relationship that we have to technologies to compare it with relationship that we have with food.
Mm-hmm.
Because these technologies have become so essential for our everyday life that we actually cannot live completely without them. But if it's too much, then we can also become quite obsessed with them, right?
Mm-hmm.
So, and it's very, very tricky to find a balance. So, it's the same with food. What if there's too much food or not enough food, right? And so how do we deal with that? And what are actually the issues that are leading us to interact obsessively with digital technologies, right? Or, excessively, let me say. That would be something to pay more attention to, I think.
Mm-hmm.
And I was really surprised that at that panel, somebody said, so she was doing research on coders and how coding can become an addiction as well. So this is something that people do for life. It's their livelihood. And at the same time, some of these people do it so much that they become obsessed or addicted to them, right? And when I mentioned this analogy with food, this researcher said, well, actually, one of the people that became addicted to coding was actually having eating disorders before that. But once she
Mm-hmm.
started coding excessively, her eating disorders were gone.
Mm-hmm. Interesting.
So yeah, to me it's a very strong analogy, and I was really surprised by it. But I think it might be fruitful to think about this.
To sum up the discussion and close up as we are reaching the end of our time, what would you say are some of the things that you're potentially looking forward to, or anything like that fascinated you most in the research that you've done so far, so we end up with a message?
Wow. um yeah, I think it is time to be it is time to be to keep the optimism, right? To keep the optimism, but not about technologies, but about people, right? So I think it's really imperative to remember that people are incredibly flexible, incredibly creative, and have survived so many things that I'm sure that we will find a way to live with technologies as well. So it's something that I need for sure. That sort of optimism that says, okay, we will find a balance one way or another. And I'm very curious about how this will go, and I'm really looking forward to learning more from the people that I meet in everyday life about how they are making the best of technologies still.
Tanja, thank you so much for taking the time for the discussion today, and I look forward to reaching out again, maybe in a year or two, to see how far you've come with your research and what are the findings. I'm sure that the world is going to probably be quite different then. So we'll speak then.
Thank you so much for this conversation. I really enjoyed it.